Hi, I'm Dr Ashish Dutta. I'm a cosmetic surgeon from the Aesthetic Beauty Centre. We are based in the northeast of England in Newcastle and Sunderland. Fat transfer is a process where we take fat from one part of the body and put it in another. As we age, we know we lose fat from various parts, for example the face, the breast, the buttocks, and if we can transfer the fat back, we get the volume back what we had in our youthful days. Fat is usually lost primarily from the face, that is visible, but also, as I said before, from the breast, from the buttocks, the back of the hands and other parts of the body. So we can transfer this fat in these areas and make them look as fresh as we can. Fat is the patient's own fat that we take, and hence it usually stays for a long time if all the other parameters are met. For example, the good aftercare, the patient stopping to smoke, etc. Dermal fillers, on the other hand, are foreign materials. They are safe, but still they're foreign materials, and once they're injected in the body, they can cause a few side effects which usually fat doesn't. For example, foreign body reaction, granuloma formation, etc. And the other problem with the dermal fillers are usually they're short lasting. Some of them are long lasting, but they themselves have pretty big side effects, and that way fat is safe and long lasting at the same time. The operation is in two processes. First is where we remove the fat. We try to do it with a low pressure suction so that the fat cells live, and then we prepare the fat by washing it, taking all the other particles that we don't want out, and then the fat is injected into the areas where we want it to stay. It is done with a very small cannula under local anesthetic, which makes the process a lot more comfortable for the patient. Fat transfer has been available for a long time. Over the last few years, the process or the treatment, the way we do the treatment has changed. In the good old days, the fat was taken out and put it in lumps, but now we put it in small pockets so that the fat can derive its fresh blood supply, its nutrients, and then can live longer. The limitations are mainly because when we're taking the fat out, it is an operation, so you can get a bit of bruising, you can get a bit of swelling, and where we put the fat back in, the same bruising and swelling can happen. However, to make the fat survive, to make the fat last longer, the patient needs to follow all the aftercare, not smoke, not expose the area to extensive heat, and if you can look after, the fat will stay for a long time. As we lose or gain weight, because the fat is the patient's own body fat, it will also lose or gain volume according to the body's own processes. We know that as we age, some of the fat usually dies off naturally, and some of the fat that we are putting in will also die off naturally as per the patient's own aging process. The fat is the patient's own body fat, so it should last as long as the patient's fat from that area is going to stay. But we also know that as the natural aging process progresses, some of the fat cells will die, and that is how it is. But in general, we tell our patients this fat will stay for at least 6 to 10 years, if not longer.